Hello, everybody. Welcome to this episode of our podcast. Today's episode is going to be talking about a new and emerging technology called Acceledent. If you guys watched this podcast about orthodontics or braces, we briefly mentioned it because I am seeing certainly there's a trend as far as trying to get braces done quicker. And we see 6-month braces. We see a lot of advertisements, a lot of ways of trying to get braces getting done. So it sounds like the consumer demand is for that. So today I have my special guest, Sean Orrell. He is the territory manager for Florida and the Caribbean, and correct me if I'm wrong, Sean, for Acceledent. So I'm really excited because he's the man with this device and can tell me what I want to know, and hopefully people out there considering Acceledent can hear it from the rep himself, somebody who's very, very knowledgeable about the device. So thanks, Sean, for being on the show. I appreciate it.
Sure, thank you for having me. It's wonderful to have a forum where somebody can talk to their patients about the newest and best products that are out there. Thanks for your support.
Well, we try. Well, let's start off. Let's try to get into it. What is this product?
It's fantastic. It's a faster orthodontic treatment device that's called Acceledent. Acceledent spelled Acceledent. The Acceledent Aura device, and I'll go into more detail in a little while. It's this tiny device. Hopefully, you can see in my hand. So it's a simple-to-use, hands-free device that accelerates tooth movement in the mouth, which is what orthodontics is all about, with only 20 minutes a day of daily use.
Okay, so my first thought is it comfortable? What's it, you're wearing this thing for 20 minutes, you bite down on it. What's the actual wearability of it? What's that like? What's the patient experience, I guess I should say?
Let's do this. Just for verbiage, I don't want to hold in my mouth while I speak, but I'll try. I have a motor mouth. That's what I do for a living. Here's what you do. The device is similar to what you like a very small, thin sports mouthpiece on a device that is less than the size of a 9-volt battery, and it weighs much less.
Okay.
This device, when pressed, put in the mouth. I want to make sure everybody can see it. I'm going to do no tricks up my sleeve. It's a hands-free device that you push a simple button on that clicks, turns green, and will send out micropulses for 20-minute sessions. Now, it's fast, it's safe, and what you were asking about specifically is that it's gentle. What I mean by that is that when it's gentle, that Acceledent patients have reported in clinical studies that it alleviates discomfort and pain, which is wonderful. What we're doing with orthodontics, as you know and as you can describe to your patients, is you're moving tooth through bone. Mm-hmm. It's a uncomfortable process. It really is. You're moving through brackets or wires or trays or whatever your process is. You're moving them. What Acceledent does is it's a patented FDA, this is what's big about this, it's an FDA-cleared, FDA-2 cleared medical device.
Okay.
It uses soft pulse technology to actually stimulate your cells in your bone to actually help the teeth move through the bone faster, gentler, and safer.
So do you actually feel it? Like, I guess my thought is if I had it, do you feel anything or you just feel like you're biting down on a wafer?
Let me ask you, it's a great question. Let's talk about the things you can identify with. Oh, I'm sorry, that your patients can identify with.
Sure.
If you ever had well, how about this? Would you use one of those micropulse, those toothbrushes?
Yeah, like a Sonicare.
Toothbrush? Imagine a Sonicare. That's supposed to be quote-unquote gentle. This is 8 times softer than a Sonicare toothbrush or a tooth device. It is also, ready for this, everyone's favorite activity, chewing. Chewing gum, chewing food. It is 400 times less force, 400, than actually chewing.
So for the most part, you're not going to feel it, or it's not going to bother anybody, pretty much.
It's not only not going to bother anybody, some of our people actually claim they actually love the device for the feeling of the relief they get from the actual tooth movement of their braces or their liner trays because it makes them feel better. It's a gentle massaging, if you will, and it's only 20 minutes per day, which lasts an entire 24-hour period. On a simple device that weighs less than 3 ounces, you can hold like this, so it's meant to be, like I said, hands-free.
Sure. Does it have a timer on it, or do you just time it by hand?
It's a great question. It sure does. It has a timer that automatically shuts itself off after 20 minutes of use. Actually, at the 10-minute mark, the halfway point, there is a distinct, different vibration period that lets you know that the device is stopped and it's ready to go. I'm sorry, that it's halfway through, and it will stop in 10 more minutes.
Sure.
So it's kind of nice, too. Also, if you can see on the end here or not, for those of you visualing, if you're not
USB?
listening on iPods, there is a USB port at the end. that is, number one, attached to a cord for charging the device. Okay. There's also a small chip on the inside, which is way more than my pay grade of electronics. But this chip allows for a usage report for the actual orthodontist to see how many times you used it. Have you used it every single day?
Wow.
Are you using it more than once a day? There's no benefit to using it more than 20 minutes a day, which is the allotted amount. But there is a report that can be generated to let you know if you have not been actual in your actual talk to your orthodontist about how many times you're using it per day.
Sure, so there's that feedback. There's that feedback. That's great. So, okay, so clearly it's pretty comfortable. It's not a problem. And so tell me a little bit about if I'm looking into this, how much faster does it make braces? So let's just say I think when I had my podcast with Dr. McIntosh, he was saying treatment is normally between 12 and 15 months. So the question is, with one of these, how much time does it save in general?
Good question. The common buzzword right now in orthodontics is about accelerated orthodontics. How can we make things faster? It's how can we make things faster for the patient, for the doctor, for the staff, for anyone. You're going to talk about for your patients. This is the only device in the world that is FDA approved as a Class 2 medical device for, number one, faster orthodontic treatment. Number two, safer. It's demonstrated safe in U.S. clinical trials, which we have more than a dozen of on our website, which I'll direct you to in a second.
Sure.
And it's gentle. The gentle micropulses, like I said, are 8 times less than a Sonicare toothbrush. So that's huge. I don't want to name drop it. I'm just saying that's how it works. So what I want to talk about is this, that your patients are going to get this to use in a faster amount of time. We can talk 30 to 50% reduction in treatment time for your orthodontic treatments. So if you have, like you mentioned, a 8, 10, 18, most orthodontic treatments when it comes to wires and brackets go around 18 to 24 months. That's kind of standard, especially here in Florida where I work. You can reduce them by 30 to 50% time.
Okay.
And what that means for your patients is, it's right now, whenever this gets released, this podcast, October, November 2014, your patients that are sophomores in high school that want their senior pictures without braces, they can't get that with regular braces.
Sure.
With this in their mouth, they can treatment time reduction of 50%, and that's massive.
Okay, so you had mentioned, I'd asked you this earlier, and this is another point, braces or Invisalign. Tell me about, can you use it with both? Is it just made, you had mentioned a few things about that, so tell me what the bottom line is for that.
The idea is this, that our product right now, we have multiple studies going on with what we call liner trays. When it comes to our product instructions, our product allowances, we are not currently on product line to say we can use with liner trays. Do I have more than 90% of my doctors using them with them currently? Yes, I do. But we're not prescribing this as a Class 2 approved FDA medical device to be used with liner trays, which is our motto, until these studies are released. Which brings me back to how this product was started. Less than 6 years ago, we had a version of this that was much larger, very different, and we would not release it to the public for orthodontic treatment because we wanted to have the FDA approved studies done first. We spent more than 2 years of sitting on a fantastic product, knowing that it would work and benefit people, because we wanted to make sure we had the FDA clearance first. We wanted to be cleared as a medical device. Sure. We did that first. So currently there are treatments and studies going on in multiple universities, which I'm not allowed to divulge, but they're happening right now so that we can say by probably next year that we can say this is in alignment with liner trays. Do I have doctors in the state of Florida that are currently doing that successfully? Yes, I do.
Sure.
So right now on our prescribing index, you can use this with brackets or hardwired braces. We're not on PI to use the liner trays, but are we against? Do we have any anti? No, there's nothing against using it with them. Does that make sense?
Yeah, so bottom line, I know so bottom line for anybody watching this, with something like Invisalign, if you are going to use it or your orthodontist is recommending, it's sort of an off-label use. It's not cleared for that yet. Certainly the company sounds like you guys do a lot of jurisprudence and want to make sure you have a quality product before you're putting it out. That's why you waited so long. And now you're doing all the testing with stuff like Invisalign or any kind of other aligner tray before you say, hey, you can use it with that. So bottom line, it's technically for regular braces, but there's a lot of people using it with aligners. And I know some orthodontists using it with aligners that also say, it works effectively. So I realize that it can be done both ways. So then the next question, how do you get them? Who do you get them for? I'm a general dentist. I don't do braces myself, but I can tell you the whole reason I came up with this, I told you the story, was I was doing an exam on a patient a couple weeks ago. He's flipping on his iPhone and he goes, "Yeah, I think I'm going to do Invisalign. And what do you think of this thing?" And I think he said it was $1,000. I forgot how much exactly he told me it was. But he goes, "What do you know about this thing?" And I said, "Man, I don't know anything about this thing. I'm an idiot." And so I said, "Well, I got to reach out and learn, because that's what this podcast is all about." So I don't know how to get it. Tell anybody watching this where to, if they're watching this podcast, they're interested, how do they get it?
Absolutely. Ask yourself, ask any of your dentists, ask your orthodontist. You can go to our website, Ortho-Accel, which is orthoaccel.com.
Mm-hmm.
We have a doc finder website there that lists the orthodontist. Because it's an FDA Class 2 device, we prescribe it as a medical device prescribed by your orthodontist. We don't just let anybody willingly have it, just for that main reason. It speeds your orthodontic treatment, and that's the reason why. So going back to what you just mentioned too, is about how it works with whatever's treatment, whether it's brackets or liners, the whole 9 yards. Any force happening prescribed by your orthodontist, is about moving your teeth through the bone. Because this device micropulses in such a specific frequency and a patented style, it does one thing only. It moves teeth through bone faster and safer. So it affects the teeth in the bone without getting scientific on you. In an osteoplastic, there's a lot of science behind it. There's plenty of looks on our website at orthoaccel.com. What I want to tell you guys for your patients is that it can move your teeth faster and safer through the bone. And that's why the orthodontist can add this to your therapy or not. Any orthodontist that you as a doctor prescribe and refer your patients to, or any orthodontist they seek out, will get them to a treatment somehow through braces, brackets, clear braces, liners, however the treatment protocol is. They will find a way to get them to the smile they desire and the teeth they desire. Question is, do you want to do it this way, or would you like to do an accelerated treatment that can get them there in about 30 to 50% faster time?
Sure. So then the other question, yeah, it does. So a general dentist doing Invisalign, can they get it, or this is specifically for
Not right now. Right now, it's only through orthodontists. It's a good question. I'm glad you asked that question.
I think about it because I know general dentists that do it.
And you had asked the question, there is an associated cost with it, which is why I say it behooves every one of your patients to do one of two things, or actually both things. Ask your orthodontist, ask their treatment coordinator. Ask the people you're talking to about your orthodontic treatment plan. This is your smile. This is your face.
Sure.
We're very fortunate. I'm very fortunate to work for this company. It's the only thing in the world that we'll do without a pill. There's no pill, no shot, no treatment plan, no electrotherapy. There's nothing in the world that can do what this device does, which is to speed, in a safe and gentle fashion, your orthodontic treatment time by up to 50%. So it behooves all of your patients that listen to this podcast right now to just ask you as a doctor, ask you as a dentist, ask your ortho that are currently seeing, ask another ortho they're maybe looking at. Find out who is doing it, and what they can also do is they can go to orthoaccel.com and look at our Doc Finder app, which you would ask the question about, and find out who is currently in their area treating them with this device. But ask about it, because this device can be done by any orthodontist.
Sure.
But it's a question of, do you want your orthodontic treatment to be faster, gentler? You want less pain? I don't know any patients that have ever raised their hand and said, you know what, I would like to have a longer treatment time and I want to have as much pain as possible. Can you do that for me, please? I find that very rare. So the truth is, what most of your patients ask is, my goodness, how can I get this off sooner? And how can I have less pain or discomfort? This is an FDA-approved, safe way to do it.
That's great. Well, the other thing that we talked about earlier is, you said, I love the fact that your company is obviously on the cutting edge, innovating and moving forward. You said earlier, if people aren't out there pushing things and trying to make things better, we'd still be on a horse-drawn carriage. Great stuff. So I really appreciate it. I've been on your website. What I'll do is I'll put it as a link onto the comments section on the video, so they have a link to it. I've also been on YouTube, and there's lots of videos of people on YouTube that are showing it and taking pictures of their teeth moving, I think with Invisalign. So I think there's a lot of information out there. I thought it was really interesting when I found out about it through my patient. I'm glad you came on. I think it's great to hear from somebody who has so much knowledge about it. So thanks again, Sean, for being on here. Anybody that's watching this, I hope you learned something, or at least we hope that we turned a light bulb on. Go research this some more. Ask your orthodontist. Ask whoever it is. I think the more informed decisions patients make all around is all around better. So, Sean, thank you so much. Anybody watching this, I hope you enjoyed it. Thanks so much.
Thank you.